So, okay, the next one I'm going to show is some digital initiatives from the healthcare sector. So, we actually started with the electronic medical record exchange for some time already. So that's where the government actually set up this website, and they started to load in the data from the public sector, the polyclinic, right? And later on, they actually open up to the private sector, participating GPs, right, to access information, and also to the charity sectors. So, and what are the information being shared? So the discharge summary of the patient, right? Lab test results, X-ray, uh, and radiologist test results. So I think X-ray has gone digital for many years already. So medical operation reports, drug allergy, medicines prescribed, right? Cardiac reports, right? Emergency department reports. So these are the information being shared. So here in the center, right, is a screenshot from my mobile phone. So you see that I'm vaccinated. Oh, so right now I need to take 3 shots in order for this thing to be green and with a tick. So if I only take 2, it will be not green anymore, right? So of course it helps to administer government policies. For example, they say that only people who are uh, who have taken minimum 2 shots, right, can enter this building, or a person now must take the booster shot, they can enter. So what we do is that we there's a QR code, we scan the QR code, or there's a machine over there that can detect our mobile phone using Bluetooth. So we flag it, there was a beep sound, okay, then the machine will show your vaccination status, right? So the machine is usually a tablet. They put a tablet on the table, you just bring your phone close to the tablet. Or for older people, right, they issue this device. So we call this the tracer, right? The tracer is given free of charge to all Singaporeans and Singapore PR, right? So you can either use the tracer or you use a mobile phone. Oh, so, and of course, you have this scan QR code function. For some SME, right, they do not have the infrastructure, right, of the bigger buildings and so on. So the government will issue them a QR code, right? So then, of course, the administration was done through the system. They scan the QR code, and the system connect to the cloud, and then of course the cloud will know that you are now in this particular premise. Okay, so this is all the COVID-19 initiative. We call it the Trace Together app. And the other one that is used by the health ministry, health promotion board, is this 365 health program, right? So they encourage citizens to exercise, to walk, right? And then how do they keep track, right? They issue a free tracker, right? I have one here. I don't know whether you can see. This is the tracker. I think the same model as that, right? So the tracker will track, right, how many steps I walk in a day. So they say, okay, if you walk 10,000 steps, right, that is the target. So then I can track, right, how many steps I walk every day. I think today I'm quite lazy. I didn't achieve. I only have 3,600 steps. So again, right, this device has evolved over the years, Now they can measure your sleep hours, they can measure your oxygen level in your blood. So this is one way, right, to keep the nation healthy. So they call it the national step challenges. And okay, these are some shots from my mobile phone. And every one of us, if we choose to, can be connected to the government WhatsApp. Okay, so this WhatsApp actually is related, is linked to the health promotion board. So as you know, right, there's a lot of fake news nowadays. Right, people tell stories and then get misinterpreted. So the government actually understand this. So from the very start, they actually started this WhatsApp app. Uh, so and of course, if they want to visit online, they have this covid.gov.sg. So this is the instruction of our latest COVID-19 guideline. So Singapore has this what we call living with virus policy now. So a lot of us contract the virus, right? I think there is some risk that the government is taking. But then if you are vaccinated, right, to the third jab, right, then of course the severity will not be so high. Or I have a lot of people around me who got COVID-19, but after 7 days they recover, stay at home, right? So this is the protocol now, so you can see that they don't need to go hospital, right? And then they give you instruction what to do. And ART is actually given to every household uh, free, right? Of course, you want more, you got to buy lah. There is I think eight ART free lah. And you want more, you can buy from the shop. And if you're tested positive, then you can ask them for more ART test kit, right? So to keep track, right, until you're 7 or 14 days. So my daughter family contracted, so they stayed at home, and then I helped them to collect the ART kits for them to test. So as of yesterday, she's not negative already. So this is the message that they send, right, using WhatsApp channel. Okay, and so this is a brochure, right, of telehealth services, right, from one of the polyclinics under the National Healthcare Group, right. So we have different types of service, nursing services, right, and doctor consultation, right, and so on. So as I mentioned on day one or day two, right, that consultation with the doctor, right, is by appointment, right, using Zoom. Uh, if we choose to be but they still do face-to-face physical consultation, right? So these are the various things that is used. Then this is the okay consult the healthcare providers you through video conferencing, right? Medication will be delivered to your home. Appointment-based consultation, reduce the travel to the polyclinic. Okay, and this is the procedure, right, on what to do, right? They actually use Zoom.